One. Live.
What's up, guys? John here, Titan Talk Tuesday. Sorry about being muffled, man, but I want to make sure that, no droplets get out there. I'm protecting everybody in the office here and everywhere else. I'm trying to set the example out there. I know a lot of people go against the face mask. I was one of those people, I think. But once you see COVID affecting people that are around you, family members, friends, right? Acquaintances, workers, co-workers, at that point, you want to make sure that you're protecting yourself, one. And if you say, hey, listen, I don't care about protecting myself, I'll take my chances. You don't want to be one of those people that spread it to somebody that has a bad, run with COVID-19. I think, the spread is slowing, but it's starting to speed up here in Tampa, right? We know that mortality, people are living a lot more that catch COVID-19 than dying, thank God. But at that point, what's the real risk of you guys wearing a mask? Some people say, I'm going to get CO2 poisoning, I'm going to get too much carbon monoxide, I'm going to pass out. At that point, listen, guys, doctors and surgeons have been wearing masks through surgeries, 8 hours, 9 hours, and a lot more PPE than you guys are wearing. So at that point, get you guys a breathable covering. I know a lot of people say, John, after 3 months, this is like why should we be wearing this right now? Listen, man, I think that everybody should take the precaution of not wanting to spread it to their neighbor, their friends, or their family. It just is what it is. So at that point, I'm wearing the mask through Titan Talk so I can show you guys can be energetic, talk loud, with a mask on if you need to be. Because here in Tampa, they're making masks mandatory. And across the country, they're starting to make masks mandatory where you're going. So at that point, you might as well get used to wearing it because it might be a part of our life and the way everything's going. I know people say it's against your constitutional right, but they make us wear pants outside, right? It is what it is. That's the only example I can really get to because it's kind of crazy. So, with no further ado, let's get into the Titan Talk Tuesday. The first one, it's still Men's Health Month. June, got to get out to all you guys out there, and you females that are loving your guys out there, make sure they're taking care of themselves, or guys taking care of your guys out there, however it is. I love all you guys, so I want you guys just to be healthy, be safe, and through Men's Health Month. With COVID-19, that's what everybody is focusing on. They're focusing on COVID-19, all these deaths, everything going on. But we really are not thinking about all the other diseases out there, viruses out there, cancers out there, all these other things that can affect us, right? And that's if we're wearing a mask or not in some circumstances. So at that point, we really got to worry about ourselves and what's best for our health and make sure we're taking preventatives, especially us as guys. So we talked about last week getting checked, prostates if you're at a certain age, making sure you're taking blood tests, making sure everything's all right there, making sure mentally, physically you guys are okay. Health-wise, even with COVID and as men, we want to make sure that we're not overweight. We don't want to get diabetes. We don't want cardiovascular issues. All these things go hand in hand. So at that point, we're really focusing on your health, internally and physically. But this week especially, we got our specials on libido enhancers. I want to talk about some of the libido enhancer therapies we have. We have a wide variety. So we're talking about our Supermans. We have sildenafil, we have tadalafil. If you're on hormone replacement therapy, we can mix some of these with micronized testosterone. Now, sildenafil and tadalafil are great as far as getting the erection, right? Getting that blood flow down to the extremities. They work kind of in two different ways. Where sildenafil works, you could be thinking about something, physically touch something, and it's on. You can get that blood flow down there and you're ready to go. With tadalafil, it might be a little bit more in depth, where it might be a mental thing along with physical thing, and you're in the moment, and that's how it works. With micronized testosterone, along with some of these, if you're on hormone replacement therapy, can you hear me out?
Yeah.
Can you guys hear me out there? Am I too muffled?
They gotta get used to it though.
All right,
That's the way it is now.
I just want to set the example. That's why I'm doing it, guys. I got my gloves on and I have my mask. I know how to wear them. After every use, you're going to take off your gloves and dispose of them properly. Okay? And I'm going to show you guys in this how to properly take off gloves. So you guys know, because I see a lot of people doing a lot of different things, and this can cause cross-contamination. Anyway, so back to libido enhancement. We talked about sildenafil, which are Supermans, along with tadalafil. 2 different versions that will both get you guys up and ready to go. Micronized testosterone, behind these things, if you're on hormone replacement therapy, can offer another benefit. And let me tell you about what it can do. So when you have sildenafil and tadalafil, you're up and ready to go. Now, some of our patients out there, they have no problem getting up, ready to go the one time, and they go. Now, for the second time, they're still ready to go with the sildenafil and tadalafil. They might not just have the stamina or energy. And that's where the micronized testosterone goes along with these things to help. Not only with the erection, for the sildenafil and tadalafil to get it up, but you have micronized testosterone for the endurance and stamina portion. It's micronized, so it's immediate and fast acting. It's not a big dose. It's a small dose, but it works very effectively in this situation. Other things for libido enhancement, especially PT141. This works for not only females, but works for males as well. And you can use this by injection form or by oral form. And what it does is it works instead of, for the physical portion, all right? For the blood, it works through the nervous system. And for the nervous system, you're getting stimulated there. So you can actually get this with tadalafil and oxytocin, which I'll talk about in a second. And with these 3 things, you can get mentally, physically ready to go, and you're just going to have an overall good time with your partner, okay? Now, we talk about oxytocin. Now, oxytocin is the chemical bonding drug, all right? It's a chemical bonding hormone. And it's used to give females, like when they're going into labor, spasms, right? They get spasms in the uterus, and at that point it helps with birth. This can also affect when they're having sexual intercourse. At that point, it can help with multiple orgasms, okay, with the spasms. Oxytocin is produced when you give your partner a hug or a kiss in low doses. If you increase those doses, it can actually help with you and your partner actually coming together a lot more and bonding. Lowering inhibitions to talk about things possibly that you wouldn't talk about with them because you might not have felt comfortable, or you have your gates up, your walls up, and that's just the way it is. So this can actually help with sexual function too as well. It can actually increase orgasms. It can help with you and your partner having a more pleasurable experience. And I think that's what it's all about. Even if you don't need libido enhancement, right? Who doesn't want to increase their bedroom activity, especially with your partner? And even if you've been with your partner for 12 years, you can always have a better experience, maybe try new things you guys like. But at that point, you could be a superhero to your partner the whole time and not having to worry about it. Some guys, they get into it and they start worrying, and it starts becoming a mental thing. Sometimes it's not even a physical thing with guys. They might have ED effects because of a mental block or something that they're worried about in their mind. And that happens more times than not, okay? I really see it a lot with patients. It might be a mental thing, and they have either problems with their partner, they have an issue they're thinking about themselves, and they can't get over it, and that's what it is. The real way to tell if it's physical or mental, this is a good test that a lot of guys, I tell them, like, listen, if you think it's a physical thing, do this test. This is what the test is, okay? So if you're with your partner, you're with a girl in person, and you're having an ED problem, and you just don't know. You're like, maybe it's a physical thing. Maybe I need Viagra. Maybe I need those Supermans, John. What else can I do? How do I really know? So testosterone levels go part of that, obviously, but the challenge or the test. If you're with your physical partner or with somebody in person and you have the libido issue, if you think it's a physical one, there's one way to tell. If you do watch a video, and the video is something that you like, that would really arouse you, okay, that really brings up that arousal button to you guys, and you guys can get aroused and have function of libido and go through the process and complete, at that point, it's probably a mental thing when you're getting there with your partner or the person in person. So if you're good without somebody there, you should be good with them there, okay? So at that point, there might be some other things you need to work on. Now, if that fails, then at that point, you might want to look at some different things. And there's always got to be an underlying problem of something that's going on. You can always put a Band-Aid over a bleeding wound, and it might help for a little bit, but you do want to get to the root of the problem. Or, at that point, you just want to perform at your utmost, ultimate best, okay? And this will take you above and beyond. You know, I like to say it's like a super soldier serum type thing. You know, you got this awesome body, you're all looking good, but hey, if you could take it up a notch and be healthy, right? Because that's another thing you want to worry about is your health factor and making sure that it's good for you to do and you're going to be okay doing it. So those are just some of the different therapies that we have, you know, for libido enhancement. Now, on to the next one. So on to this mask thing I'm wearing, right? Because I'm wearing a mask, I'm wearing gloves, and there's a reason I'm trying to set the example for people out there, showing that you guys can do it too, because a lot of people complain about the mask. Now, Arnold Schwarzenegger. I know probably pretty much everybody's out there knows who Arnold Schwarzenegger is. Well, Arnold Schwarzenegger went to Venice Beach Gold's Gym, and he's an icon there, okay? He's been there for I don't know how many years. He went into the gym, and in California, they wanted to wear masks in the gym, any public places. So at that point, he went in there, he seen that nobody was adhering to the mask policy or social distancing, and what did he do? He turned around and he walked right out. The reason, because people are like, well, why, Arnold? Like, you're Mr. Terminator. Why do you walk out? You're Mr. Billy Badass. The reason is because he's at high risk because of cardiovascular issues. So at that point, he doesn't even want to put his life in risk. And it is a risk. You know, a lot of us, if you catch COVID-19, you'll probably be asymptomatic or very light symptoms, but there are people that it affects in terminal ways. All right, I know a lot of people that have been in the hospital, a lot of people that's been affected by this. So at that point, I'm going to make sure that I take a stance and let you guys know the real truth out there of what's going on. Because I know, like, I watch like news, I see social media, and at that point, like, what can we really believe? The CDC and the WHO have went back and forth on guidelines, what we should do. Don't wear a mask, wear a mask, don't do this, do that. But we do know that some of these things do work. And we do know that a mask is going to definitely help you not spray stuff out of your mouth into other people's mouth, nose, or eyes. And it's going to give you some sort of protection of your nose and mouth. Leads to my next thing. Wearing a mask properly. So this goes a long way because I see it all day now. If you got to wear a mask, wear it properly. And what do I mean by that? So when you're out in public and you're talking with people, don't do this. Don't do that. It defeats the purpose of you wearing a mask. I know it's tough to maybe hear or speak through it, but we got to do it just for a little bit. I really just want to press this to you, all right? And the next thing is, don't wear your mask like this.
Yeah.
I got my mask on, you know? Like, dude, if you're going to wear a mask, wear it properly. That's the whole reason to wear it. Or don't wear it, I guess, you know? At that point, make the decision. You guys will ultimately have to make that decision, and it's ultimately going to come back to you guys possibly or one of your family members or friends. I mean, I know a guy, and I was talking to him today, Jay, and basically his son, asymptomatic, no problems, gave it to his mom. His mom then gave it to him, and then he went into the hospital, which wasn't very fun. He was in there for 9 days with like pneumonia, very serious stuff here, and he had to be given some medication, so that's crazy. Mark Buccetti, so is this an N95? I have my N95s in the closet. The only reason I'm not wearing an N95 is because a lot of people cannot get their hands on N95s. Real, true, genuine N95s. And if you can, wear one. If not, there are ones with filters and with, basically you get charcoal filters. You can actually order MERV 13 filters and actually cut it out or lining, and you can put it in the inside. If you guys don't know what MERV 13 is, that's the rating for filters through air systems. And 13 is the utmost highest. That means it's going to get everything that pretty much goes through there. N95s are great. N95s will take out 95% of what's coming through there as far as that goes. The bad thing about N95s, if you're sick, everything you breathe out, it's not getting filtered. So people that are around you, they're not going to be able to, not get sick if you're sick with COVID-19. So at that point, don't go around them if you're sick like that. Make sure if you guys can't get an N95, get it. You can put a covering over it, make it look real cool. Or you can get one of these cool things. Make sure it has a filter in it if you can. Some sort of filter, charcoal filter, MERV 13 if you can't find any, cut out your own. The cloth, I guess, in your utmost last option. If you don't have anything else in your car and you're going to wipe something, it is what it is. It's going to help a little bit. It's not going to block everything. So I do agree with people out there saying, hey, listen, what's this face covering going to do? It might not block everything, but it might block enough where it protects you. You never know. And it's going to be able to protect against droplets coming out of your mouth too as well a little bit, right? So that's what it is. All right, so COVID-19 is no joke. I know a lot of people, when we were in lockdown and stuff like that, it's a government conspiracy. People aren't getting it. Do you know anybody that has COVID-19? And everybody's like, oh, I don't know anybody. Do you personally know? Well, I do. I'm sure a lot of you guys, especially if you're here, are going to find out people have COVID-19 or had COVID-19. And at that point, just be there and support them as much as you guys can, Make sure you guys are practicing social distancing and you guys are trying to wear a mask. Even here in Florida, the governor just went on and said he's basically going to pull people's licenses from bars and nightclubs that are not adhering to these guidelines because people are getting sick. There was one place in Jacksonville, 13 patrons got sick. 13 staff members got sick, and 28 patrons got sick here in Jacksonville. So it's pretty serious. And people might not even know that they have COVID-19. That's a scary thing. It's invisible, and some people are asymptomatic, and they have no fever, no temperature. So you temp check them at the door, and they're walking through, they might be asymptomatic, and they could be spreading it down. It's just such a crazy thing. I've talked to so many doctors about it, especially the last 2 days. And at that point, it's just all over the place with information and things that are going on and misinformation. There are some drugs out there that are working pretty well in the hospitals. So thank God for that. Hopefully, we're going to get over this, but hopefully we don't get a second wave. And hopefully if you guys get sick with COVID-19, you guys do the right thing. And at that point, hopefully you guys are healthy afterwards, and you'll have antibodies for a little bit anyway. Get tested. So I want you guys to find a place that you guys can get tested at. CVS's are doing them. Health departments are doing them. There's a lot of places. And a lot of people want to get tested. So some of these places have lines. Some of these places have weeks waiting times. You guys can probably find a clinic if you guys want. You guys can probably pay that clinic. I know these tests are supposed to be free. So at that point, you guys can go to these places and try to get them for free. If not, you can buy the test from, I have a practitioner do you in office in a clinic. And at that point, they can get you the results and let you know. Not the antibody test, but the COVID-19 test that says yes or no if you're positive or negative. Then after that, you can do an antibody test. But to find out for sure if you had COVID-19 or not is a big step. And a lot of places say, if you don't have any symptoms, don't worry about it. Well, like I said, there's asymptomatic people out there, so they have no idea if they do or don't have it. Insurance companies. Now, insurance companies have been paying for these tests for private citizens. They actually said that they might not be covering all these going forward. And the reason why is because people have been abusing it, whether it's protesting, rallies, not adhering to social distancing and stuff like that. They're going to be pulling back on some of these tests they're going to be paying for. So get it now while you guys can. Big warning, big shout out to you guys to do it. I'm giving you guys some good information. So at that point, use it, all right? Because of this spike in Tampa, we were having the Team Titan workout this Saturday, June 27th. I made the executive decision that I do not want to do that just because I don't want to get anybody sick or have anybody spread this to anybody else. I want to make sure that we're at least calming down in our area. Some of you guys' states and areas might not be that bad. Here in Tampa, we, and Florida especially, we are on fire. I don't care what any of the media outlets tell you. I don't care what DeSantis says. We are on fire, dude. We are on fire. Literally, like the house is burning down. We need to make sure that we put a stop and a halt to this. So many tests are positive. I can't even tell you guys. I want to make sure that I just put it in you guys' brain. So the Team Titan workout this Saturday will be postponed, and I'll make it, I don't know when. I'm going to make sure that these cases start going down and that we can do this in a safe and proper manner. The health of my staff, the health of my team is utmost importance to me and first priority to me. So at that point, it is what it is. So we'll have to do it another time. I'm sorry, guys. I appreciate all your support. Some different immune system boosting therapies. So with COVID-19, and let's forget about COVID-19. Let's think about all the other things. All the diseases and viruses, when it's sinusitis, the flu, you get a common cold, you might have an immune system that is impaired. And at that point, what do you do? Even if you're at high risk or you have diabetes or cardiovascular issues, you guys should be looking to boost your immune function. And how do you do that? So there's a number of different ways, from different fruits that have antioxidant properties in them that you guys can take, from supplementation or therapies from us. So a lot of fruits, vegetables, those are really good in some of the antioxidant properties. Now with therapies, there's a lot of different therapies that you guys can use. One is glutathione. Glutathione is a super antioxidant. It's great for inflammation. And by the way, that's what happens with COVID-19 patients. They get real bad in their body at that point, starts signaling, and the inflammation comes. And then that's where the real problems start with patients with COVID-19 is inflammation. So the point is to keep the inflammation down. That's why they're using a steroid called dexamethasone. They're using this in hospitals right now to take inflammation down, and it's a steroid. So at that point, it's being used. But you guys will have the choice to use some different things like glutathione, thymosin alpha-1, which is a peptide that increases T cells. And why is that important for this? Because we want to increase our T cells in our body. That's an immune system response to go track down viruses, cells in the body to take them out. And at that point, hopefully boost immune function and support so you guys can either be strong in the immune system or get over whatever sickness that you have. Another one, Nectar of the Gods. So Nectar of the Gods has a couple key components in it as far as arginine. It has lysine, it has glutathione, it has NAC, L-carnitine, proline, taurine. So this one is a real good daily one. It's got 60 milligrams of glutathione in it. The regular glutathione comes at 200 milligrams per ml, where this comes 60 milligrams per ml. It's got all the other amino acids along with it for extra benefits. Okay, so these are some good ones. Another good combination, injectable vitamin C and injectable zinc. So we offer these therapies as well. You can get them single, you can get them combined if you want to, or two different therapies. And at that point, you're going to boost immune function with these in response. And some of the hospitals with COVID-19 patients were actually using high doses of vitamin C injection, actually through IV. So intravenously. If you can't do the IV, at that point you can take the injection. They were also using zinc at high doses. And this is just to help. We're not going to say that this is a true preventative or a true cure for COVID-19, but they have been using these things. And we do know it's good for immune function, okay, and support. So at that point, I want to get this information out to you guys. I think it's important. I think it's vital for people to know real facts and to educate themselves on how to A, protect themselves, or B, get over whatever they have. And I think it's important because a lot of people are out there and they're looking for their family, they're scared for their wife, their kids, their adults, their parents, people that might be immune compromised or in high risk because it's that serious. So I just wanted to go over some of these different things with you guys. I'm sorry, but it had to be a COVID-19 day on this show. It's truly important to get the information out. I think there's a lot of garbage out there, and I want to show you guys, especially with the mask and the gloves, use them properly, use them right, and they will protect you and others around you. If you use them and you're not, see, I keep touching this mask with my gloves, right? So at this point, you need to do, you need to clean these things. That's another thing I want to bring up. So once you take off your gloves and you have your mask, okay, and you've been touching it all day, and you've been touching other things and touching a glove like this is contaminated. So you need to sterilize it in some way, shape, or form. Whether it's washing at home, you can hand wash your mask. Now, N95s, you're not doing that. And some of those are only good for limited time use. And if their structure is compromised, they're not going to work effectively. If you have a mask like this, a cloth mask with a filter insert, you guys can get yourself these LED sterilization boxes. Now, this one's a kind of big one. I'll show you guys another one next Tuesday. This one's a hard case. Really easy to use, really efficient, works very fast, and it's very portable. Now, I have one that actually folds too, and UV lights actually kill the virus. So at that point, you guys can put your mask or phone or keys in here, whatever you guys touch, and it'll be sterilized. And at that point, you guys all know it's sterilized, okay? And you guys will know it's safe. So that's what you guys can invest in. They're pretty cheap. You guys can get them on Amazon, anywhere else. But I thought it was pretty key to show you guys, hey, listen, what do I use? What's going to be effective, truly effective, and this will definitely help. All right. Next thing is breathing. Make sure you guys, if you guys are having COVID-19 issues, you're having symptoms like shortness of breath, make sure you guys are getting checked. Make sure you guys are okay. And if it gets too bad, please go to the hospital, guys. I know the hospital is the last place you want to go or the last place you think you want to go. But if it gets that bad, you guys probably have no other place to turn. That might be the only resort. So I appreciate you guys tuning in with me and bearing me talking through this mask the whole time. It's a challenge, right? I've got to talk. I got to do this. But I'm showing you guys. I'm breathing hard. I'm in here, and I'm doing this, right? I have to put this out. Thank you, Jay. I appreciate it, man. Bonnie, thank you. Mark, I appreciate you guys tuning in. All you guys at Instagram, thank you guys for tuning in. So what I want to do is this. Usually I give away a free shirt or leggings. Since it's COVID-19 day, and we're talking about all these different things and talking about being prepared, what I'm going to do is this. I'm going to do a COVID-19 package. The COVID-19 package, I'm going to give you hand sanitizer, Purell hand sanitizer, okay? I'm also going to give you 2 N95 masks, real 3M N95 masks. These came from Henry Schein, which is the medical supplier for all the medical clinics and medical community. So at that point, they got some stock in. They sent me about 8 boxes. So I have some boxes. I want to at least give away 2 N95 masks, and I want to give away 2, and they're like this big, Purell hand sanitizers. That way, I can give somebody some protection if they're going to walk out in public. Or they got to go somewhere, at least they got hand sanitizer, and they have a real, true N95 mask. One more other warning I want to do, and I just thought about this. I apologize. So make sure that you guys are looking at the hand sanitizer that you guys are using. The reason is the FDA came out and they made a statement saying that there are multiple brands of hand sanitizer that came from Mexico, and at that point they're poisonous to people. And rubbing them in and absorbing the skin, or kids ingesting them. They're made with a different chemical. It's not ethanol. It's not isopropyl alcohol. I can't remember what it is real quick. But it's a different form. I guess it cleans wood or something like that. I was reading the article, and at that point they put this out. So make sure you guys are looking at the FDA. They advises the consumer alert on hand sanitizers. Let me see. The Mexico presence methanol. Let me see. I'm gonna tell you guys what's in it right now.
There's the infected products. Holy crap!
Yeah, there's 9, and they all have the exact same thing in them. It's really, really crazy.
Wow. There's all nausea, vomiting, headache, death.
According to the FDA, substantial methanol exposure. That's what it is. It's methanol. That's what's in it. It's not ethanol, but methanol. And methanol exposure can result in nausea, vomiting, headache, blurred vision, permanent blindness, seizures, coma, permanent damage to the nervous system, or death. This is very serious. So if you guys want to look and make sure that your hand sanitizer is good, go to the FDA website. They have the contaminated products from Mexico. The reason they put this statement out is they contacted the distributors of this, No recourse was done by the distributors, so they had to put this warning out to people that had this. So at that point, you guys are safe, all right? For the COVID-19 survival package, that's what I'm going to call it, the survival package. 2 Purell hand sanitizer bottles, about that big. They're little hand ones. 2 N95, real N95, 3M respirator masks, and I'll throw in a t-shirt for you guys. All you guys got to do is text COVID-19 to 727-389-3220. So hashtag COVID-19, text that to 727-389-3220. I appreciate you guys all tuning in today. Thank you guys for all the support and listening to me. I helped you guys out. Let's slow down the spread as much as possible. You notice how they say slow down the spread, not stop the spread? It's because they know we're probably all going to catch it. That's how fast this thing transmits to exposure. So at that point, or gets people exposed to it. Do the right thing. Protect the people around you. It might come back to you as karma if you don't. All right? Love you guys. Thank you guys for tuning in. I'll see you guys Friday with Drew. Titan Lifestyle, 2 p.m. Thank you guys. I appreciate it.